We had a patient who came in with a chest infection who had been confused for many years. They participated in one of our studies, which was about optimising medication review in hospital using a clinical risk assessment tool that I've developed called the Drug Burden Index. It measures the cumulative side effects of a range of different drugs which slow you down mentally and physically. So this patient went in our study and we managed to stop 2 of them. A couple of days later, the patient's wife came to us and beaming thanked us and said, "I have not seen my husband like this for years. For the very first time since I bought it for him, he's actually able to use his smartphone." And he had really just come back from years of confusion by tweaking his medicines. My research plan is all about how to optimise medicines for older people. By doing my clinical work, I inform my research questions, and by answering my research questions, I make sure that we can get evidence-based care into practice as soon as possible to ensure we use medicines in a way that is safe and effective. As a geriatrician, I admit older patients to the hospital and look after them when they come through the emergency department. About 20 to 30% of the time, that's actually due to a drug-related problem. And that's something that we were doing as part of our study, but it's something that I do every day in my practice. We're now trying to roll out some of our research into tools that can be used in general practice and in nursing homes, as well as in hospital. The vast majority of people say their goal is to optimise their function, to keep themselves independent physically and functioning as well as they possibly can mentally. Our local health district has one of the oldest populations, so people doing research are interested in understanding the effects of ageing and frailty on the management of the diseases that they treat. Ideally, in 5 years' time, I would like to see the Drug Burden Index used widely in practice in the hospitals, in the community and in residential aged care. As you get older, the things that you really don't want to happen, like falls, frailty and confusion, are caused by a myriad of different factors, and most of them are pretty hard to reverse. But the most reversible is the side effect of a drug. And if we can detect those side effects early by using a tool like the Drug Burden Index and prevent that reversible functional decline related to medicines, then we can make a really big difference to independence and quality of life in older people.